So what I wanted to make clear also by talking about public health, the health of the population, is the healthcare sector or the health of a population is a mirror of society. It means when you look at the state of health of a population, you can read in that health state of the population, whether in that part of the world human life is respected or not, whether there's respect or not for the individual person and its needs. What is the state of nutrition, of what people eat, or food? Do they eat enough, and is the food good? You can see in the state of health of a population what is the quality of air, water, lodging, the security of transport systems, maternal and child care, is it good enough? Infectious disease, what are the risks of infectious disease? You can read the level of education, where education is of a higher level. Generally, people are in better health. And most of all, this is why I put red color here, you can read in the state of health of a population what is the level of redistribution of national wealth. Is it well distributed or not? What is the social division in the country? Is it a united population or is it a divided population between different groups? And finally, what is the equality between the people, between ethnic people or social groups, between the rich and the poor? All this you can read in the state of the population. And the second message is investing in health means you make savings for tomorrow. Any penny, any euro you invest in good healthcare, well-organized healthcare, makes you save money tomorrow. Then you can invest the money in the economy. So, and if you don't invest in healthcare, you will have a lot of expenditure and a lot of loss of labor force and loss of riches later. So this will be my last picture. It is in fact already for tomorrow, for the next session. It is a sort of conceptualization of healthcare systems. Whatever healthcare system, it is built like a house or like a temple, if you prefer. This picture comes from a research term in Germany, a team in Germany, from the University of Bremen, who do a lot of comparative work. And they have been looking into so many healthcare systems and try to ameliorate the classification of healthcare systems. So we'll say a few words tomorrow on this. And came out with the idea that we can analyze any healthcare system by its three fundamental missions, which it has to fulfill. And that is financing. There must be funding, and it must be organized. There must be service delivery. There are people who actually deliver the care, the health professionals. And there must be regulation somewhere. So these are the three basic functions of every healthcare system, whether it's poor or rich, whether it's good or bad, it will have these three functions. Now, how does this function? It's like building a house. First, you have to have a foundation, which is supporting all the rest. So the foundation is here, the guiding values in a society. What are the preferences in a society? Is it to have the biggest army in the world? Or is it to have the healthiest population in the world? Is it to have the happiest children? Or is it to have, I don't know, most of cars on the motorways? So the guiding values, where do you put your investment for now and for the future? What are the goals of a society, the social attitudes, the preferences? These are the foundations which will determine the financing for healthcare, what type of financing and how much, and it will determine the delivery system, to whom you give care, how good the care will be, how well trained will be the professionals. And in order that this functions, I mean, in a way you could say the values are translated into policies via financing and via delivery. So, and then you have somewhere somebody who is regulating all this. who's regulating the financing agencies, telling them they should take contributions not higher than 10% or very low in order to keep the money for other things. Or they will tell the service provider that they must see many, many patients a day in order to fulfill access to care for everybody, but never mind what is the quality of the care. Or they will tell them they have to be very good doctors and they have to take time with each person. So there will be somebody who regulates all this. So the translation of these values into policy goes via financing and delivery. And then the regulator, this will be the state or the central government, will make the policy which corresponds to, let's say, what people voted for. And so either for healthcare or for economic growth. And so the regulation will be on the exercise on the financing agencies, on the service providers, and on the potential beneficiaries. That's the people like you and me. They will regulate whether I can go directly to the hospital or whether I need to pass by the family doctor to get a transfer for the hospital. I mean, all this is regulation. So this is a very important function. It is a function of the supreme political power. And it will be connected, of course, to the guiding values and goals and attitudes in order to make function your healthcare system.